Hi everyone. Today in this video we are going to discuss about azithromycin. How this antibiotic acts, what is the mechanism, side effects, precautions and clinical indications of azithromycin we will discuss in this video. What is this drug? We can see the suffix thromycin. Still we have few of the antibiotics which are ending with the suffix mycin, but this is a drug which is having the suffix thromycin. This suffix indicates this drug belongs to the chemical class of macrolides. We have few of the other drugs within this category such as erythromycin, clarithromycin. These two drugs are having the similar suffix thromycin. And similarly one of the ketolide, telithromycin. All these drugs are having the same suffix and works by same mechanism. So among these, azithromycin is one of the macrolide antibiotic that can be used for respiratory tract infections. Here the term macrolide indicates these drugs are having large structure, and among these azithromycin, the prefix aza indicates it is having the azalide structure. So today in this video we are going to discuss about this azithromycin. What is the chemical nature of this drug? As we have discussed, azithromycin is a macrolide. It is having a large structure. So this is the structure of azithromycin. And within the large ring, we can observe the nitrogen is present. Erythromycin as well as clarithromycin are not having this nitrogen, but azithromycin is only having this nitrogen. That's why this drug belongs to the class of azalides. Azalides are the large cyclic compounds with nitrogen within the ring. With respect to erythromycin, the introduction of nitrogen leads to azithromycin. Azithromycin is effective against the gram-positive infections such as Streptococcus pneumoniae, Streptococcus pyogenes and Staphylococcus aureus. In all these infections, azithromycin can be used. And again, in the gram-negative infections, this drug is useful. Particularly, this drug is effective against Haemophilus influenzae, Moraxella catarrhalis and Chlamydia trachomatis, which produce STD. In all these infections, azithromycin is effective. Even this drug shows the broad spectrum of activity and long duration of action, but azithromycin should be used in confirmation of any bacterial infection. Without any bacterial infection, the use of azithromycin may lead to resistance in the patients. That's why azithromycin is clinically used for acute bacterial exacerbations of COPD, chronic obstructive pulmonary disorder. In the COPD, when the bacterial infection is increased, it leads to few of the symptoms such as severe cough, wheezing, severe chest congestion and dyspnea, difficulty in breathing is observed in the patients. In such situation, azithromycin can be used to control the bacterial manifestations. Similarly, azithromycin can be used to treat the acute bacterial sinusitis. Again, in this bacterial infection, we can observe excessive nasal congestion, some facial pain as well as pressure, along with fever, cough, and increased yellow or greenish discharge from the nasal cavities. All these can be observed in the bacterial infection. Again, in such situations, azithromycin can be used. But without confirmation of bacterial infection, this drug should not be used. Another important indication of azithromycin is in the treatment of community-acquired pneumonia, which is commonly known as CAP. This community-acquired pneumonia may be produced by Streptococcus or Mycoplasma pneumoniae. In such situations, again, azithromycin can be used. And apart from these respiratory infections, this drug is also effective against the urinary tract as well as pelvic regions. This drug can be used to control uncomplicated skin infections, genital ulcer disease, urethritis, cervicitis. In all these conditions, azithromycin is indicated. Now let us see how this drug acts. Azithromycin is one of the macrolide antibiotic which can bind to 23S ribosome within the bacteria, thereby can inhibit the formation of 50S ribosome within the bacteria. But during the elongation, azithromycin can inhibit the translocation process. So within this bacterial protein synthesis, the newly formed peptide chain can be translocated from one side to the other side. This translocation can be blocked by azithromycin. Now this azithromycin can bind to this 50S subunit, thereby can prevent the translocation within the bacteria. So this is one of the action of azithromycin on the bacterial protein synthesis. But apart from this drug also shows some immunomodulatory activities. Azithromycin can act on the immune cells as well as epithelial cells. So once this drug is going to enter into the immune cells, it can interact with the phospholipids. And once this azithromycin interacts with the phospholipids, it alters the membrane fluidity. Similarly, this drug can also act on the few of the immune mediators like AP1, activator protein 1, and NFKB, nuclear factor kappa B. These mediators are responsible for the gene transcription and they produce few of the genes which increase the cytokine production as well as mucin production. Now this azithromycin can interact with this AP1 so that it can modulate this transcription factor, and it can also interact with the NFKB and again modulate its activity such that azithromycin can inhibit the cytokine production as well as mucin production. And it can also show few of the delayed pharmacological actions. This drug can also promote the lysosomal accumulation which increase the phagocytic activity. In this way, azithromycin modifies the immunity and it shows some anti-inflammatory activity by immunomodulation. What are the precautions? One of the important precautions of azithromycin is on the cardiac system. This drug can increase the QT interval, and when this QT interval is increased, it can precipitate one of the fatal cardiac arrhythmias, torsade de pointes. This is a condition which is observed by increased QT interval within the ECG. So suppose this is a normal ECG with P, QRS and T wave. In presence of azithromycin, this QT interval is going to be increased. Increase the QT interval may precipitate the cardiac arrhythmias, and sometimes it can precipitate the fatal cardiac arrhythmia, torsade de pointes. That's why this drug should be carefully given in the patients who are already having long QT syndrome or the patients who are having the cardiac disorders with already elevated QT interval. Similarly here, few of the drugs like class 1A drugs such as quinidine, diisopyramide, procainamide, all these are the class 1A antiarrhythmic agents. Similarly, class 3 drugs like imidazole, sotalol, dofetilide, ibutylide, all these are the class 3 drugs. These class 1A drugs as well as class 3 drugs, both of these antiarrhythmic agents can increase the QT interval within the ECG. Now, azithromycin can also increase the QT interval. So, when this azithromycin is combined with the class 1A drugs or class 3 drugs, it can further increase the QT interval. Similarly, few of the other drugs like moxifloxacin. Moxifloxacin is a fluoroquinolone antibiotic, and quetiapine is one of an antipsychotic. So, many of the drugs can increase the QT interval. So, these drugs should be carefully combined with the azithromycin. Otherwise, we have the physiological conditions like hypokalemia, decreased potassium levels, or hypomagnesemia, decreased magnesium levels may also increase the QT interval. So all these conditions should be thoroughly checked before azithromycin is prescribed because it may lead to elevation of the QT interval and fatal cardiac arrhythmias. Second important precaution is that azithromycin can produce the hepatotoxicity. So it can produce some elevation of liver enzymes. It can increase the bilirubin levels along with the excessive deposition of cholesterol. It leads to cholestatic jaundice, some hepatitis, liver infection, hepatic necrosis, damage to the liver. All these are possible with the azithromycin at a high dose used for longer periods. So particularly if you have the symptoms like abdominal pain, dark urine, joint pain, fatigue, nausea and vomiting, if any of these symptoms are observed thoroughly in the patients, then liver functionality test should be done. If any liver damage is produced by azithromycin, then this drug should be stopped and replaced with an alternative drug. Similarly, third important precaution of this drug is the production of hypersensitive reactions. Azithromycin can produce few of the severe hypersensitive reactions like the anaphylaxis, where few of the symptoms like skin rashes, itching can be observed, some difficulty in breathing, rapid pulse rate, and fainting can be observed in the patients. Similarly, it can also produce angioedema, the swelling of lips, hands, feet can be observed. And sometimes this drug can also induce a fatal hypersensitive reaction, Stevens-Johnson syndrome. This is one of the fatal hypersensitive reaction that produce some blisters on the skin as well as mucous membrane, and if it is untreated, it may lead to the death of the patient. So if any hypersensitive reactions are observed, then immediately azithromycin should be stopped and replaced with a alternative agent. Similarly, azithromycin can also increase the symptoms of myasthenia gravis. So some muscle pain and muscle weakness can be increased if azithromycin is given in the patients who are having myasthenia gravis. Similarly, this drug being an antibiotic, it can inhibit the bacterial gut flora, which is fighting against few of the pathological organisms. So when this azithromycin is used, it can increase the cultures of Clostridium difficile within the colon. This leads to diarrhea in the patients. This is a common symptom observed with many of the antibiotics, which are going to inhibit the bacterial gut flora. Thereby they can promote the growth of Clostridium difficile organism. What are the side effects? Azithromycin generally produces few of the side effects such as diarrhea, which is because of Clostridium difficile infection, and it can also produce nausea, anorexia, loss of appetite, abdominal pain, skin rashes, pruritus, and it can also produce few of the infections like vaginitis, and it can also produce few of the gastrointestinal side effects like dyspepsia as well as flatulence and gastritis, headache, bronchospasm, and dizziness can be observed with this azithromycin. Apart from these side effects, azithromycin can also increase the QT interval within the ECG, as well as it can also produce some hepatotoxicity, which should be carefully monitored. How it is given? This drug is available as a tablet, capsule, suspension, which is suitable for the oral purpose, and it is also available as a dry powder, which is reconstituted for IV injection, and it is available at the different strengths with azithromycin at 500 mg or 250 mg, and the dose of the drug depends on the particular clinical conditions. For instance, in case of SCAP, community acquired pneumonia, this azithromycin is given as 500 mg on the first day. Then the dose is going to be reduced to 250 mg. So 250 mg dose is given for the following 4 days. The total course of azithromycin is 5 days for the treatment of community acquired pneumonia. Similarly, for bacterial infections, azithromycin can be given at a dose of 500 mg once daily, and it is prescribed for 3 days. And the dose can also be variable based on the clinical condition. So that's about this azithromycin. Azithromycin is a macrolide antibiotic which shows activity against gram-positive as well as gram-negative infections. But this drug should be carefully given in the patients who are confirmed with bacterial infection. Otherwise, it leads to development of resistance in the patients. And this drug is a macrolide belonging to the subclass of azalides. This drug is long-acting as well as it shows broad spectrum of activity. Being a macrolide, it can inhibit the protein synthesis within the bacteria, it can inhibit the translocation, but this drug also shows some anti-inflammatory activity due to its immunomodulatory properties. It can interact with the phospholipids, it can promote the lysosomes, it can modulate the transcription factors like the AP1 and NF-κB such that it can control the cytokine production as well as mucin production. This drug can increase the QT interval within the ECG, which may lead to cardiac arrhythmias. That's why this drug should be carefully given in the patients who are having the risk of increased QT interval within the ECG. So drugs like class 1A drugs, class 3 drugs should be carefully given along with the azithromycin. Azithromycin can also increase the hepatotoxicity, so liver functionality test should be checked when this drug used for longer periods. Hypersensitivity is another important precaution that should be monitored. It can produce some of the severe hypersensitive reactions like the Stevens-Johnson syndrome. So that's about this azithromycin. Hope you have enjoyed this video. If you like this video, please subscribe to our channel. Share this video with your friends. Post your comments in the comment box. Thank you for watching this video.